This is Neil's On Dynasty. I'm Neil reporting to you live from Neil's basement. I have a few reports here from Harley. Harley wants to say something. And that's the news from the kitty world. Now the real news that you might want to know about that no one's talking about is the healthcare industry. No, not in America. The one that's fixing to go bankrupt in China, which just adds to the housing issue, the banking issue, their loans with Sri Lanka, Pakistan, and Turkey that they're not getting paid back on. And it just adds to the pile of my level of confidence in investing in the yuan, the digital yuan, because China's sound right. All right, here we go. Let me get the volume up here so you guys can't hear it. Here we go.
The industry is the world's second largest, closely behind the U.S. It is growing at an impressive speed. Spending has soared from under 500 billion yen, $74 billion in 2000, to more than 7.2 trillion yen, $1 trillion in 2020. China's healthcare system includes hospitals, public and private, primary healthcare institutions, community healthcare centers, rural healthcare centers, and village clinics, and other healthcare institutions, such as women and children healthcare institutions, special disease prevention agencies, and centers of disease control. Hospitals play the most crucial role in the nation's healthcare services industry, with revenue making up 75.7% of the market share in 2020. After the nation's reforms in the healthcare industry, the private healthcare system has grown in its importance to reduce the overburden of its public counterpart. However, this success has not lasted long, as many private hospitals declared bankruptcy in China this year. The trend of hospital privatization. The last decade saw dramatic growth in the private healthcare system. Before 2015, the number of private hospitals was always left far behind of the public ones. After 2015, with gradual growth, private hospitals surpassed state-owned hospitals, doubling their figure to nearly 22,500 hospitals in just 4 years from 2015 to 2019. In 2020, there were 23,524 privately owned hospitals, making up nearly 66.5% of Chinese hospitals. By contrast, there was a downward trend in the number of public hospitals. 2015 recorded over 13,000 public hospitals, but the figure decreased to 11,870 in 2020. Outpatients and inpatients received by private hospitals have continued a rising share of total hospital patient visits between 2016 and 2020. A rise from 12.9% to 16% goes to outpatients, 15.9% to 19.1% for inpatients. 2017 statistics from the National Health and Family Planning Commission show the compound annual growth rate, CAGR, of public hospitals have been unchanged over the past 7 years, while that of private hospitals reached 16%. Market research from Frost & Sullivan estimated that the revenue from private institutions would triple to $90 billion by 2019 from 2016 levels. Problems of private hospitals. Although the private system dominates China's healthcare market regarding the number of hospitals, it is outweighed by the publicly funded system and other aspects. For example, in terms of patient visits, private hospitals account for nearly 15% in 2020, while public hospitals take the rest. Private hospitals tend to be smaller and specialized, while public hospitals have more beds, staff, and tertiary care capacity. The average public hospital has 280 beds with higher occupancy rates. Several super hospitals with more than 4,000 beds, such as Zhengzhou First Hospital, can take in as many as 20,000 outpatients per day. In stark contrast, 83.5% of private hospitals have less than 100 beds and have an average occupancy of 40%. Since private hospitals offer high out-of-pocket costs, they usually cater to citizens with private insurance, such as foreign expatriates, medical tourists, and affluent Chinese residents. Other issues facing the private system are the recruitment of high-quality physicians and the lack of public insurance coverage. Apart from the above-mentioned matters, the most significant problem of China's private healthcare system is zero-COVID measures. The nation's anti-epidemic approach has forced hospitals to suspend many services that generate revenue. Consequently, many hospitals have suffered a financial failure, leading to a disarray in the private system. The private healthcare system gets hurt due to strict COVID controls. As reported by Reuters, footfall has dropped sharply in private hospitals, partly caused by policies forcing them to send patients with COVID-like symptoms to public facilities. Due to widespread strict lockdown and a fear of being forcibly quarantined or hospitalized, many residents have been unable or unwilling to reach hospitals. The government also put a cap on drug prices, a lucrative source of revenue for many hospitals. In other words, the government's measures have deprived private hospitals of revenue. 46 large private hospitals declared bankruptcy in China last year. This figure almost doubled from those two previous years, particularly 26 in 2020 and 21 in 2019.
That's just like 90 hospitals, private hospitals, closed in 2.5 years in China. Went bankrupt.
In the first 5 months of 2022 alone, 26 private hospitals entered formal bankruptcy proceedings. As many as 685 hospitals, including both public and private, closed in 2020 only, nearly 2 times higher.
685. Now, at first, they were talking about the private hospitals being in. This says including both public and private closed, nearly 2 times higher than the number previous year.
Than the number.
That means they've had almost 1,000 public and private hospitals. That means 900 public hospitals have closed and 100, a little shy, private hospital closed in the past 2.5 years. Wow.
Of the previous year. Kan Yiji, a Chinese medical industry information service specialist, says, since January 2020, in order to cooperate with the city's epidemic prevention and control work, the hospital suspended some diagnostic and treatment activities and income fell noticeably. Kaiji adds, there was basically no medical income and the economic pressures were huge. Medical journal Lancet Regional Health published a study in 2021 showing that crippling losses in revenue can threaten the survival of a large number of healthcare facilities and providers.
Wow. If I got those numbers correct, this is the first time I watched it all the way through. That's over 1,000 hospitals they've closed down in a little over 2 years. About, I think 91 or 92 private hospitals. But that's where the main money loss is coming from, because private hospitals have to report earnings, to where the public hospitals controlled by the CCP don't have to report earnings, so you don't know how much of a loss they've taken. But we do know from these numbers right here that were just given that there is at least 900 Chinese CCP public hospitals closed in the past 2 years. Any economists out there who deal in insurance or in hospital numbers for profit margin and loss have anything to say about that? Please leave a comment below to inform me, because I just got the numbers. All I know is there's 900 public and 100 private. I don't know, any of the numbers on the private ones, obviously, but some other people out there smarter than me hopefully do, and leave a comment and help inform us. All right, you guys, buy some silver and some platinum. Be kind, helpful, and grateful, and for inflation reasons, to save money, pick up some extra food when you go to the store. Don't buy less, buy more. Because next week it's going to be twice as well. Not twice, it's a lie. It'll be like 10%. Or excuse me, no, let's go with the average that Joey has. It'll be 9.1% more expensive in a week. So buy 2, buy 3. Your money's going to go further today than it'll go in 7 days. Have a good night.